Hi, Miss Allen. How are you?
Hey, how are you?
Good, good. My name's Joan. I'm a nurse, and so I'm gonna want to go through a few questions with you regarding your health and what's going on. So I understand you went to the hospital recently.
Yeah, I went to the ED last week and I had a fall and they took me in. I was feeling pretty bad, but they just said I was dehydrated and so they gave me some IV fluids and sent me home.
Okay, all right. Well, let me just ask you some questions. If you have any questions you want to ask me, that's fine. We just want to take a look and see if there's some things that we can help you with. What do you prefer to be called?
Oh, you can call me Gracie.
Gracie? Okay, that is fine. So Gracie, how old are you?
67.
Okay. And what's your marital status? Are you married, single, divorced?
Yeah, my husband died last
Okay,
year.
all right. Do you, let me just go through a quick list of your past medical history. Just tell me if you have any of these things in your history. Do you have osteoarthritis?
Yeah, I do.
Okay. Osteoporosis?
No,
No? Okay. Um, high lipids in your blood?
not that I know of.
Okay. Hypertension? High blood pressure?
Yeah,
Okay. Depression?
yeah, for sure.
Okay. Anxiety?
Yeah,
Any pain issues?
yeah, I got a lot of pain.
Okay, we'll come back to that one in a minute. What about your vision? Do you have any, I see you wear glasses, but do you have cataracts or macular degeneration? Any other eye problems?
I just wear reading glasses. I know I'm supposed to have prescription, but I can't afford them. But I
Okay, we'll take a look at that too. Any incontinence issues?
yeah, especially at night.
Okay. What about heart disease?
No, not that I know of.
What about strokes?
Nope.
Parkinson's, MS, seizure history? No.
No.
Vertigo, like getting dizzy when you
Yeah,
get.
that's what caused me to fall.
Okay. Um, Diabetes,
Yeah.
type 2 diabetic or type 1? Type
Type type
2?
2.
Okay. Do you have any asthma history?
Chronic bronchitis.
Bronchitis? Okay. Any emphysema? Overweight?
Yeah.
Oh,
Actually I just lost 30 pounds over the past 6 months, but
okay.
I'm still 160,
Okay. How tall are you?
5'1".
5'1". Okay. Do you have any memory problems? No?
Mm,
Any weakness?
yeah.
Okay. We'll come back to that too. Anything else that I didn't go through that you have?
Well, they say I have restless legs, which
Okay.
really is a pain trying to sleep
Okay. Anything else?
with. I get constipated a lot too.
Okay. All right. Um, Pain issues. You mentioned you have pain. Where's your pain at?
A lot of my legs, a lot of
Legs.
joints, but mostly in my legs.
Does it hurt all the time or does it come and go?
It hurts pretty much all the time.
Okay. And what would you rate your pain at from 0 to 10, with 0 being no pain and 10 being the worst pain?
Like most of the time, it's a 8.
8? What is it right now?
Mm, the 8.
8. Okay. And do you take anything for that pain?
Yeah, I take Norco.
Okay. How often do you take that?
No, I take about 8 of them a day.
8. Okay. Do you know, well, we'll come back to that when they get to the pharmacy piece. Do you have any surgery history?
No.
No surgeries? Okay. All right. So I'm going to go through just some other general questions, just general health habits. So do you drink alcohol?
No.
Okay. And then do you smoke?
No.
Do you have a history of smoking?
Yeah.
Do you know how long you were a smoker?
20 years.
And when did you quit?
About 20 years ago.
Okay. And was it just cigarettes is what you smoked? Yeah, okay. And then how many packs a day?
2.
2 packs a day? Okay. Do you have a history of, I know you the falls recently. Is that the only fall you had last 3 months?
No, I've fallen 3 times.
Okay. So when you fall, is it because you get dizzy or do you trip? Your legs give out?
No, I get dizzy.
Dizzy?
Yeah, it's always been at night, and I'm
Nice.
kind of rushing to go to the bathroom, so I just get dizzy when I stand up anytime.
Okay. All right. Did you have any injuries from those falls?
Uh, just bumps and bruises. Nothing
Okay.
got broken or anything.
Okay. And did you lose consciousness at all? No? Okay. Vision, you said you have just to see close. Is that what you're wearing glasses for?
Yeah.
Okay. Your vision far away is okay?
No.
No, neither. Um, uh, did you ever have a pair of prescription glasses?
No.
Okay. But you do need a pair of prescription glasses. Okay. With the glasses that you have, are you able to see enough to get around
Yeah,
or not?
good enough.
Okay. All right. Um, let's see. And are you supposed to wear glasses all the time?
Yeah.
Yes. Okay. Do you still drive?
Yeah. I just haven't been lately because there's really nowhere to go. I can't get out and like go to the store or anything, and my church has been shut down, so I haven't been driving for a
Okay.
while.
But you do have a car?
Yep.
All right. Have you had any accidents
No.
driving? No. Okay. Um, do you know what your normal blood pressure is?
It's been pretty good lately. I think last time I was in the ER, they said it was like 130 over 90 something or something like that.
Okay. Do you have a blood pressure cuff at home?
No.
No. Okay. Um, are you able to find your pulse on your wrist?
Yeah.
Can you count for me once you find it? And hold on, let me just pull my timer up. And just count for me out loud, and then I'll tell you to stop. So whenever you're ready, just go ahead and start. Okay, 69, that's pretty good. Okay. Um, you already said you said you get dizzy from going from sitting to standing every time you get up? Pretty much. Okay.
No.
All right. And then if you can describe your appetite for the last 3 months.
Eh, haven't been that hungry. Just I don't know. I have some nausea. I've been taking some medicines for that, but so and then I don't know. With all I used to order out a lot, but with the pandemic, I've been kind of nervous about doing that. So I just kind of been cooking stuff on my own.
Okay.
Yeah, you can probably see my little stovetop thingy.
Oh yeah. Okay.
Yeah, so
All
I
right.
just,
Do you what type of things do you cook?
A soup. I cook a lot of soup.
Okay.
Yeah, my Campbell soup, I cook that.
So it's canned. You don't make it by scratch. You cook it from a can. Okay.
Yeah, I don't do really any cooking anymore.
Okay. All right. Anything else besides soup?
Um, I eat chips and crackers and stuff like that.
Okay. Do you get are you able to get meat, vegetables?
Meat, I was trying to get some meat. My daughter does my shopping about once a month, and
Okay.
I was trying to get some meat, but man, it's gotten really expensive with
Mm-hmm.
all of this going on. So no, I haven't had meat for a while.
Okay. Okay. I know you said you had 30 pounds of unintentional weight loss in the last 6 months.
Yeah, but that's good, right?
Well, yeah, it is depending on what's causing you to lose that weight. So that's what we want to kind of look at. Um, and then how many servings of calcium do you get a day? Like milk, cheese, yogurt?
Well, I don't drink milk. Um,
Okay.
my daughter, when she gets me groceries, she usually gets me a pack of cheese, and when I get the cheese, I eat it with like crackers, but it doesn't last, you know. So,
Okay. All right. Do you have enough, do you have enough money for food?
for the most part, I mean, nothing fancy. I don't eat a lot of fancy food, so.
Okay. All right. I do want to do a quick screening for just depression. And so I'm going to pull this screen up so you can see it, and then you can tell me how you fit into this screen. Can you see my patient health questionnaire?
Really little.
Oh, is it? This is big on my screen. I'll read it to you.
Okay,
Are you using a computer or are you using a phone?
computer.
Okay, okay. So the scoring is 0, not at all, and 3, up to a 3 means nearly every day. So just tell me on the statement, in the last 2 weeks, how have you been bothered by any of these problems?
Okay.
Little interest or pleasure in doing things. So do you have any questions for me? You're gonna have a couple other people talking to you today, and then we're gonna get back together and go over kind of what we found.
And just check in and ask you some questions. How are you today?
Pretty good. How about you?
I'm doing well, thank you. What is your perspective right now on your health situation and living situation right now?
Well, my husband died a year ago, so and then with all of this pandemic and everything, with my health and age and everything, I've kind of had to isolate, really taking it serious. So, I see my daughter about once a month. She comes, but she works in the ER, so she's nervous about coming over and everything. So,
Sure.
so it's been tough. It's been tough. Church is shut down. I mean, I've done a little bit of that on Zoom, but
Okay. And I'm just going to take a few notes as we're talking. Is that okay?
yeah, sure.
Okay. I'm sorry to hear about your husband. And so, have you been working with anyone about the grief related to that loss?
No.
No? Okay. Okay. What kind of supports do you have right now? I hear that your daughter is working full time in a healthcare situation, so there's concerns there about her bringing that into your home. Do you have any neighbors or family? I know you mentioned your church.
Yeah, I mean, before all this COVID thing started, I have friends at church and they were being supportive and stuff, but, we'll talk on the phone every now and then, but it's, not the same as getting together and stuff. So, and you know, neighbor wise, I've been isolating. I haven't really been getting out much. So,
Okay. In terms of phone call, or do you use your computer? Obviously, you know, I knew you had a computer today. Do you use any social media or FaceTime?
no, I don't.
Okay.
I think that stuff's, I hear bad things.
Okay.
Yeah.
Okay. Okay. And so you're currently living alone?
Yep.
Okay. And tell me if you feel safe at home.
Yeah. I've lived here a long time. I feel safe here.
Okay. Okay. Do you have any sort of notification system in case you have an emergency? Like a lifeline or something that you can wear to alert for assistance?
Nope.
No? Would you be open to something like that?
I guess it wouldn't hurt. Last time I fell, I thought about that and I thought, yeah.
Okay. Especially just being discharged to home after this recent fall, that's something we can certainly set up for you. I'll look into some more information about that for you. Can you tell me about your nutrition? I'm sorry, Mrs. Allen?
I was just going to say, it depends how much it costs.
Okay, and as a social worker, that's something I can certainly look into for you as well. We can find out what resources are available and what might be covered under your insurance or your Medicare, okay? And I'll follow up on all of those things, and we'll make sure that that's all clear before we bring anything in.
Okay.
Okay. In terms of eating, do you have, are you able to prepare your meals? Do you have enough money for food?
So yeah, I explained this to the nurse. Haven't had a big appetite. I'm kind of nauseated and taking some meds for that, but you know, I don't really eat a lot of fancy stuff. And then like things like meat and stuff had just gotten so expensive. I don't even buy it. My daughter goes grocery shopping for me, brings food over like once a month.
Okay.
But I like, so I showed her, I've got my little cooktop over here and
Okay.
I've got my soup and, you know, crackers and stuff like that I like to eat. So
Okay.
I got it kind of convenient. I mean, I have what I need.
Okay. Well, and once we all meet together as your interprofessional healthcare team, and we're able to determine if we can, you know, help you get your appetite back and maybe a taste for things that you enjoy again. Because it looks like with what you have now, I can see in your pantry there with the soups and the crackers, that may have been okay for you when you're not feeling well and had some, you know, nausea due to maybe medications or just everything that's been going on. So would you be open to maybe a meal delivery service? And again, we can look at all the financial resources for that to make sure we could have something delivered to you, because of course the hope would be that you'll be able to regain your appetite once we get your medications under control.
So is all that safe with the virus and everything?
Yeah, so what we can do is we'll certainly coordinate, and I'll do all the phone calls on this, and I'll ask them, what are the safety precautions Meals on Wheels is doing right now with COVID-19? Because I have no doubt that they've had to come up with a safety plan as well, and we can review all of that.
Okay.
Does that
Yeah.
sound reasonable to you?
Yeah, as long as it doesn't cost too much and as long as they're doing, you know.
And that can be free or on a sliding fee scale. So that's something I know that we can implement for delivery for you at no cost to you. In terms of the grocery store, you mentioned that your daughter is primarily doing the grocery shopping, but that's a delivery about once a month. You mentioned that you do have a relationship with folks at your church. Would you be open to me reaching out to them to maybe bring things over? I'm sure they have some volunteers on a more regular basis, just in case your appetite is getting better and you'd like something.
Well, yeah, but I don't want to put anybody out, you know. I mean, we got kind of have a lot of older people in my church, and
yeah,
everybody's kind of in the same boat as me, I think, a little bit as far as needing to be careful. I wouldn't want to put anybody at risk, you know. So.
And were you doing that type of volunteer work with your church at one point for folks who needed it?
Yeah, till all this happened, yeah.
And so let me ask you this. Did you feel when you were able to do that for individuals in your congregation that they were putting you out?
No.
No. So I have a feeling that that might be the same, because there's something about being able to give back when we can, and there's something about being able to receive when we need it. So I'm not going to pressure you on that, of course, just something for you to think about, that that may be an additional option. And it sounds like you have some rich relationships there, and folks would really like to give back. So something to consider. We can revisit that one next week when we talk.
Okay.
Okay. Okay. Who would you say is your primary care provider?
My daughter.
Your daughter? Okay. And how far away does she live? I know she works full time and has limited availability, but what's the distance?
She lives down in Columbus.
Okay. So good few hour drive then. Okay. And how have you been getting to medical appointments? What's your means of transportation?
I've been doing virtual stuff
Okay.
for, since this all's been going on. I mean, I took the ambulance after I fell, but everything else has just been using this stuff.
Okay. And do you have a follow-up appointment with your primary physician where you are going in coming up? Okay. Well, if that comes to be, we can also coordinate. That's another role that I can serve to help find some resources for transportation that will be covered under your Medicare. Okay. So keep that in mind.
I mean, I have a car. I haven't had any problems driving, but I got the oxygen and just
Right. So maybe that's on hold for at least temporarily, then, you driving yourself.
Maybe.
Okay. Well, and like I said, we can continue to revisit this. Okay. All right. And you did say you participate in a community faith organization. And do you mind providing me with the name of that church so I can reach out to them to see about supports for you?
Yeah, it's called Family of Faith.
Okay. And is there a particular contact person that you would like me to reach out to?
No, probably the minister, yeah.
Okay. And would you be open to having anything delivered to your home from the church? I don't know what your practices are, but if there was I know they're doing communion and delivering that to folks who are homebound. Are you interested in anything like that?
Yeah, I didn't know they were doing that.
Yeah. So they're delivering it. So in terms of social distancing, they'll leave it right on your front porch in a bag. And then you do have the option, if you would like, I can check with your minister to see how they're handling it, but you can do it individually or virtually, kind of like we're meeting today, where you can log in and Zoom with your congregation. Have you done that yet?
No.
Okay. Would you be interested then if I can find out more information of how your church is handling this? Okay, then I'll do that. I know that you have Medicare. Do you have any health insurance in addition to that?
No.
Okay. That will help me. I can explore, what avenues we can go in terms of the financial issues with getting help in the home. How about medical assistance, Medicaid?
No.
No? Okay.
Like right on the border. I have them a little bit too much,
Okay. That's helpful for me as well, because then I can reach out and find out what other resources are available. And these are things, after this initial assessment, we set up a follow-up, then we can review options, because I also want to make sure that we're only bringing in things that you would find helpful. Okay. Let me ask you this. What is the most important thing to you regarding your health right now?
It's probably getting my pain under control. I just feel like it's keeping me from getting up and moving around. I feel like I'm just getting kind of weaker. I'm not doing a whole lot. I don't know. I just feel like if I could get up and, do more stuff, might be Might make things a little bit better.
Okay. Okay. Well, then we're here to work with you on that, on achieving those goals. The last part of our time together, and of course, I'm going to touch base with you to make sure that we haven't missed anything important, but I'm also going to be doing the mini cognition assessment. So I'm going to, first of all, do you have a piece of paper and a pencil handy that you can show me that you have available, something to write with?
Yep.
Don? Okay. Okay. And there's 3 different parts to this. So at the beginning, I just want you to listen very carefully because I'm going to ask you to remember, draw, and then recall towards the end. So first of all, I'm going to say 3 words that I would like you to repeat back to me now, and then also try to remember them for later.
Okay.
The words are banana, sunrise, chair. So please say those 3 words back to me now.
Banana, sunrise, chair.
Great. And then I'm going to ask you to remember those for later. And the next step is I'm going to ask you to draw a circle like a clock on your piece of paper for me. And then go ahead and show it to me when you're done. Okay, excellent. And then I'm going to ask you to put all the numbers of a clock in where they go. And then show me this on your screen. Okay. So Mrs. Allen, what have I missed today?
Essentially, occupational therapy, we look at the things that occupy your time. So all the things that fill up your day. We look at how you do the things you do. We look at what's important to you. And we look at sort of where you do it and the environment that you do it in.
Okay.
I think we lost. Are you with me?
Mm-hmm. I
Okay.
heard everything.
Good. So I'm going to ask you a lot of questions that might seem random at first, but I just need to get a picture of all of those elements in terms of how you're doing what you're doing. All right, so let's just start with some basics. Tell me about where you live. Do you live alone?
Yeah, I live alone in a ranch house. My husband died a year ago, and my daughter lives in Columbus, and I see her about once a month.
Okay. So you live in a ranch. So the good news is that there's not an upstairs. Everything's on a main floor for you. Are there any steps coming into your home?
Yeah, like 3.
3. Is there a handrail with those steps?
Nah.
No. Okay. So my understanding is that you haven't exactly been firm-footed as of late.
Yeah.
Yeah. So
Fallen 3 times. Yeah.
Can you tell me a little bit about the nature of those falls, where they happened and when they happened?
So every one of them has happened at night when I'm getting up to go to the bathroom.
Okay.
Yeah, I just get dizzy and I fall. The last time was the first couple times. Last time I thought maybe I really hurt myself, so I ended up calling 911. I went to the ER, but they just said I was dehydrated and sent me home.
Dehydrated.
Yeah.
Is that the first time you'd been dehydrated? Do you know?
That I know of.
Okay. Okay. All right, so there's a lot of information there. So bear with me. So in your home, you have a couple steps coming in, no railing.
Right.
So have you been going outside at all?
Not much.
Okay.
Not much since the pandemic. I used to, I used to get out, do stuff with the church. But I used to, go to the grocery store and stuff, but I'm like, I'm taking it serious because I'm kind of at high risk. So my daughter does my shopping. My church isn't even open now, so they're doing things on Zoom. So yeah, I haven't been out much.
So you're very isolated at this point.
Yeah.
Yeah. How's that feel?
Not good.
No.
Nope. Nope. Been watching a lot of TV, been working on my quilts, but other than that,
Okay.
honestly, my legs hurt so much, it's hard for me to, do a whole bunch of anything anyway. So I kind of spend a lot of time sitting sort of, here.
Okay. And I imagine with all that sitting, you're not feeling particularly strong, or at least not as strong as you had been.
No, man, I'm really, I can tell I'm getting weak. Like opening cans or bottles. Yeah,
Yeah. Yeah.
getting hard.
Yeah. All right. Well, so you live alone and your daughter is in Columbus, which so about 2-ish hours away, 2.5-ish. Do you have friends? Do you have anyone near you that stops in or checks on you or?
No, I mean, most of my friends are from the church and they're all old, and so it's like, I don't want anybody coming and, risking getting sick or something like that. So my daughter works in the ER too. So she's kind of limits her visits because she's afraid, she might give me something. So
Sure. Does your church, other than Zoom, are you aware if your church has any outreach ministries at this point?
nah, I don't know. I don't know. Somebody else mentioned that, like communion or something, and I don't know. She was going to check.
Okay.
So I don't know.
All right. All right. Well, let me ask you a few more questions about your house and about the things that you do. Do you have any pets in the house?
Yeah, I got 3 cats.
Oh,
They were my husband's, and
okay.
truthfully, I'm not much of a cat person, but
But they
he
require
loved them.
care. And have you
So,
been able to keep up with their care?
well, yeah, they've been okay. I mean, my daughter brings like big bags of food, and honestly, there's like this feeder thing that they just eat. It kind of fills itself, so it hasn't been too bad.
Okay. Are your cats the kind of cats that get underfoot?
Well, sometimes, especially at night. One
Yeah.
of them's black, so it makes sometimes, yeah,
Mm.
it's hard to see
So
that one.
with the falls that you've had, have your cats been involved at all? Have they been the cause, do you think?
No.
No. All right. All right. Well, we'll talk maybe a little more about that. How, do you have a basement in your home?
Yeah,
Is the laundry down there?
yep.
Okay. So tell me about how you're managing laundry at this point.
Yeah, my poor daughter, when she comes, she's bringing laundry or bringing groceries, and then she's doing my laundry. So I'm kind of once a month, basically getting laundry done. I'm not that active, so like, I wear real comfortable, like just t-shirts and stuff around the house, and
I think a lot of people are getting comfortable in this COVID.
yeah.
But are you, and forgive me for this personal question, but are you changing your clothes regularly?
Well, I gotta admit, I'm wearing my clothes probably more often than ever before in my life. So just, I feel like I'm not doing anything, so I'm not really getting them dirty. Plus, I can't do laundry. So yeah, I'm probably wearing an outfit a couple days in a row.
Maybe a little more than you would normally for your normal pattern of things.
Mm-hmm.
Okay. Tell me about your bathroom. How many bathrooms do you have?
I got one.
One.
So yeah, it's kind of a challenge. I have a bathtub that there's no like nothing to grab onto. Like it's not real safe. I've definitely sort of slipped, and
Yeah.
I haven't fallen, but it worries me.
Yeah. Do you take baths or do you take showers?
Baths.
So you're a bath girl.
Yeah.
Yeah, and I would assume, given what you've been telling me, getting down into that bathtub and getting back out is unnerving. We'll put it in the unnerving category.
Yeah. Yeah.
Okay. How close is your bathroom to your bedroom?
It's pretty close, like
It's
20 feet.
Okay. All right. All right. So you don't have any grab bars or anything. How is it when you sit on the toilet and getting up off the toilet? Is that challenging at all for you?
Yeah, my knees are, the main source of my pain. So yeah, it
Yeah.
definitely can be challenging.
So one thing that we don't necessarily need to do this today, but something that I would like to do in the future is maybe go into the bathroom together, either virtually together or physically together, and just really get sort of the lay of the land with that and see what that physical space can accommodate in terms of some safety equipment for you, because it sounds as though that's, especially if you're using it a lot in the middle of the night, that's a place that we really want to pay particular attention to make sure that that's safe for you.
Okay.
Okay. Thinking about your bedroom, your bathroom, and just your house in general, tell me about the lighting. You need to paint the walls, but we do need to look at contrasts that allow things to be easily seen, pathways that are maybe uncluttered. I don't know if you have much clutter around, but those are things that we want to really tune in and pay attention to make sure that your environment is as safe as it possibly can be for you.
Yeah, I have like my carpets, like you can see my carpets are kind of white. So I think that helps a little bit with the,
That helps.
think. I don't know.
I had that quick glance. Are there many things on your floor? Do you have kind of clear access on your floor, would you say?
Oh, for the most part, yeah.
Okay.
Yeah, I know where my hallway's clear.
Okay. How are you doing with that tubing? Does that get in the
I
way?
have it so that I can go, without having to like disconnect or drag anything with me. So yeah, it's pretty long.
Okay. All right. So you feel as though you have enough room to move around in your house then? And enough tubing to get you where you need to go. So that's not the issue. The issue, from what I understand, is some general weakness and maybe some pain, particularly low extremity pain. All right.
Yep.
What about upper extremities? Do you have pain in your arms or your shoulders or your neck? Or?
I do have pain in my joints. I mean, since I'm not walking on my arms, I guess it doesn't affect me as much, but yeah, I think that's like why I'm wearing t-shirts and stuff, is because I don't have to struggle, getting other things on.
Keeps it simple.
Yeah.
Do you have any limited range of motion? Any limited movement? Like, for instance, can you lift your arms up over your head? Almost. Is that as far up as you can go?
Yeah.
What about, can you touch the back of your neck? Can you get back there?
Yep.
Can you get like to your lower back?
No.
It's a little trickier.
Yeah.
Let me ask you to do just one more thing for me. What about your neck? Can you look side to side? Okay. Okay. So, because some of what can cause someone to fall is that they're not necessarily looking, like taking in their full environment, and as we carry pain, we tend to not do those things, not move. We limit our range of motion. So maybe it's just some gentle exercising might be something, or gentle stretching might be something that could serve you well as we go forward.
Yeah. Yeah.
Yeah. And talk about how we manage pain. How are you managing your pain?
So I take the Norco. I take like 8 a day, but it doesn't like it's my pain's like usually about an 8. So I don't know. I
Okay.
mean,
It's about an 8.
yeah, I sit around like when I get up to walk. My gosh, I can barely move. It's like I shuffle.
Yeah.
It's just like it's
So you're not really picking up your feet as you move through. Okay.
not at first. It seems like it takes me a while if I'm up for a while, but then I get like short of breath, and it's like that's why I spend a lot of time sitting in my chair.
I noticed that as we're speaking, your chair is moving. Are you in a rocking chair? Is
Yeah.
that your go-to chair?
Yeah.
How easy is that chair to get out of?
It's pretty easy to get out of. Yeah, I could rock myself forward.
So you just made my heart skip a beat. I have to tell you that, Gracie. All right. So again, maybe in the future we're going to look at what you have in your environment in terms of furniture, and see maybe if there's better better places to sit or ways to be comfortable where you're on, more firm footing, where you're on steady ground. I like a rocking chair too, but it can get, especially if you're spending long periods of time there, it can be tricky to get in and out of. Okay. So let me ask you about some basic things. We talked about bathing. You said you're a bath. You like to take a bath. I want you to tell me if you can do this thing on your own, if you need a little bit of assistance, or if you need a lot of assistance, or if you're dependent for doing it. So bathings, at this point, are you doing that on your own? Tell me if you were going to give me a rundown on your day, how would that be? What time would you wake up?
Oh, I get up about 8 o'clock anymore.
Okay.
Used to get up earlier when I had stuff to do in the day, but now, so I get up about 8. I kind of look at the news a little bit, and I drink an energy drink. I get a diet pop, and don't usually eat a breakfast, but then I pretty much, sometimes I get a bath in the morning, sometimes I don't. And then I'm like, come here and I sit in my chair and I've got my remote, and I like to quilt. That's my big thing. I've got a lot of quilting done.
Okay. And what time do you usually go to bed?
Well, I don't know, because I turn on the TV and I just sort of wait until I nod off.
So you nap during the day.
Yeah, I have a hard time sleeping though, because I got like restless legs, so sleep's an issue.
Are you are sleeping in bed though at night?
I get up out of my chair after I nod off, and then I go to bed. Yeah.
Okay. All right. So let me ask you this question. Looking back at the things that we talked about in reference to your falls, I mentioned that we're going to look at how your environment is organized. We're going to look at the lighting and make sure that everything has some clear contrast for you, and that you can see what you need to see. We talked about maybe doing some gentle stretching and some range of motion, maybe some gentle strengthening exercises, so that you're feeling a little stronger for doing what you need to do. We looked at we talked about maybe adding some adaptations to your bathroom in particular, to make sure that you have what you need to feel safe in there. I noticed that you're saying that your activity level isn't what it typically was, that you're not necessarily doing the things that you would under different circumstances. And that some things like cooking, laundry, those things, cleaning, that you had always had at a certain level, or maybe not at that level at the moment. Is that a fair assessment?
Mm-hmm.
You are able to keep up with your quilting, but socially you're not necessarily connected like you once were.
Yep.
If occupational therapy was going to work with you and address all of those areas, would that be adequate for you? Or are there other things that you think are important that I might have missed?
No, that's pretty, yeah. If you could help me with that, that would be great.
All right. All right. I think that those are all doable. That's the good news. And I'm going to be honest, Gracie, as I listen to you speak, your voice is kind of low, your energy is a little low, and I'm wondering if you aren't reacting to all those things, you know, feeling isolated and all of that. And you're feeling a little lower than you might have. And my hope,
I feel it. Yeah, I do. Yep.
My hope is that as we come in and we start working with you and we address all of those areas, that even your mood or how you feel about things will improve as well. Because I'll be keeping my eye on that as well.
Great. I hope so. That'd be great.
All right then. Well, it was so nice speaking with you. Do you have any questions for me before I go?
So hi, Mrs. Allen. My name is Sue Fosnight. I am a pharmacist, and I'm part of the team that is seeing you. So I wanted to go over your meds with you. Before I get started, how would you like me to call you, either Mrs. Allen, or would you rather go by Gracie?
No, call me Gracie.
Okay, great. So Gracie, we're going to start out with your medications that you take for your high blood pressure. Can you tell me what you take, what the name of that medication is? I do have a list, but I just wanted to make sure that it's the exact same thing that you're taking.
That was a hard one for me to say, labetalol or something like that.
Yes. Okay, great. So I do have labetalol. And do you have the dose and the strength?
Yeah, 100 milligrams. And I take that in the morning and at night.
Okay, great. And then I have a couple medications that go together that you use for swelling in your legs. Do you have the names of those medications?
Yeah, Lasix.
Yes, I have Lasix. And the how often do you take that, and what is the dose?
I take that one. It's 40 milligrams, and I take that morning and at night.
Okay, great. Now, when you say you take it at night, what exact time do you take that one?
About 8 o'clock, something like that.
Do you find that you have to go to the bathroom a lot at nighttime?
Oh yeah. That's
okay.
That's what caused. I mean, I get up, I get dizzy. That's how come I fell. I've fallen 3 times in the past 3 months. So yeah.
Okay. Well, we'll check to see if we might be able to change that time then. How about usually when you take the Lasix or furosemide, you also have to take a potassium supplement. Does your doctor have you taking a potassium supplement?
Yep, he does. And it is 20 MEQ.
Okay.
Take that morning and night.
Okay, good. All right, the next the next medication I wanted to ask you about was for diabetes, and I had you on a medication called glimepiride. Is that what you're taking?
Yep.
And what is the dose on that one, and how often do you take it?
I take that 4 milligrams, and I take that every morning.
Okay. And then have you had any sugars that are low, that would be less than 70?
No.
Any sugars over 200?
No.
Okay. The next group of medications that I have is medications that you use for mood and also for anxiety. I had you on a couple medications for that. Do you have those handy?
Yeah, so I take Prozac.
Okay.
And that's 40 milligrams, and I take that in the morning.
Okay. Anything else that you take for either mood or for anxiety?
Yeah, I take Ativan.
Okay.
I take 2 milligrams, and I take that every morning.
Okay. So for the Ativan, how long have you taken that medication?
Oh, I've taken that for a long time, like 10 years.
Oh, okay. And the Prozac, how about that? How long have you taken that?
Like 2 months ago, they started me on this one. I was taking something else. Forget. Anyway, about 2 months.
Okay. Do you know why you stopped the other one?
Something with my heart or something
Okay.
like that.
Okay. Thank you. Do you feel like your mood is doing pretty good? Your anxiety fairly controlled, would you say?
Honestly, I don't feel that the mood is all that much better.
Okay. All right. So I also had a medication for pain. It sounds like you have quite a bit of pain in your knees. What do you take for your pain?
I take Norco, and this one is 5/325.
Okay. And how often do you take that?
I take about 8 of them a day.
Okay. And how many at a time do you take then? It says that you can take, I have it on a list also, and it says you can take up to 2 tablets. Is that what you're taking, is 2 tablets most of the time?
Yep, that's what I take.
Okay, so you take that 2 tablets about 4 times a day, then it would end up being. Is that correct?
Yep.
Okay, great. You have what's called restless leg syndrome, where you get those that pain in your legs that make you feel like you have to move your legs. I have you on a medication for that. So it's what I have on my list is Mirapex. Can you tell me the dose on that?
So I take 3 milligrams at night.
Okay. Okay. And then, let's see.
So I also take the pramipexole. They just added the Mirapex a little bit ago, but because the pramipexole wasn't doing it, so they added on the Mirapex.
Oh, okay. So what is the dose on that pramipexole? I didn't have that on your list that the pharmacy sent over.
Yeah, I used to take it, and then they added Mirapex, so it was 1.5 milligrams, and I take that at night.
Okay, so you were on the pramipexole 1.5, and then they added the Mirapex 3 milligrams.
Right.
Is that correct?
Yep.
Okay, so I think I will check with your doctor just to make sure that that is correct. It's a little unusual to be taking that high of a dose, and just want to make sure they didn't mean for you to just go to the higher dose. So we'll get that clarified for you to just be sure we got you on the right dose there. Now, when you take that medication, have you, sometimes it can cause some dizziness. Have you noticed that?
Yeah, that's why I fell.
Okay, so you are noticing some dizziness. Okay. Yes, so I will give the doctor a call about that, and we'll get back to you, hopefully later today on that. Now, I have a few medications for your stomach. So tell me about what's going on with your stomach. You seem to have several different medications that do different things.
Yeah, so I take the Prevacid for heartburn.
Okay.
It's 15 milligrams. I take that in the morning.
Okay.
And then I take Reglan 3 times a day.
Okay.
And I take promethazine and that's 25 milligrams, and I take that at night.
Okay, we didn't have that promethazine. All right, so so you take the Prevacid for heartburn, the metoclopramide. You take that 3 times a day. And have they told you what kind of symptom does that help to take care of? What does that help with? Any idea?
I thought it was trying to help with the nausea.
For nausea. And then the promethazine you also take, is that for nausea also?
Yeah.
Okay. All right. And then any other medications that you take on a regular basis?
I don't think so. I think that's it.
Anything that you don't need a prescription for?
Yeah, I take aspirin.
Okay. And okay, so you take the aspirin, and what's the dose on that aspirin?
The
And how
81
and then
once a day.
81 milligrams, and how many times a day?
Once a day.
Okay,
yeah.
just once a day. Do you have any herbals that you use?
No, just.
Okay. So I see that you also have a diagnosis that's of COPD, which is chronic obstructive pulmonary disease. So you have some problems with your breathing, is that right?
Yeah.
Do you use some inhalers to help with your breathing?
Yeah, I'm supposed to, but those are kind of expensive. So I do all right with the oxygen.
Okay, so you do use oxygen. Is that oxygen something you use every day?
Yep.
Okay.
Yeah, if I don't use it and I start getting short of breath, then I get really anxious, and it's not good.
Okay. So talking just a little bit more about your pain, I noticed that you're on the Norco. How would you say your pain is controlled?
I mean, it takes.
If you were going to pick between, 0, no pain, 10, your worst possible pain, where would you land?
I feel like it's mostly like most of the time I put it around an 8. Like
Around an 8.
Yeah.
Oh, so not very well controlled. What does your pain feel like? Can you describe it for me?
So it's like my feet tingle a lot.
Okay.
And it bothers me. And then there's just like really achy.
Okay. Have you found anything that helps your pain?
Not a lot.
Okay. Anything you've noticed that makes it worse?
No, just
Okay.
moving around.
Okay. And any time of the day that you've noticed that it gets either better or worse?
No, I may be worse in the morning. I don't know.
Okay. So with your Norco that you're taking, you still have 8 tablets a day. Oftentimes people will have problems with constipation. Are you taking anything for constipation, or do you have that issue?
Yeah, I do a little bit. I mean, it's not horrible, but no, I don't.
Okay. Okay.
Anything.
All right, so just a few more questions I wanted to just about in general with your medications. So you're on a lot of medications, and you're on a few medications that can cost quite a bit. So I know you told me about the inhalers, and that's not unusual for people not to be able to afford their inhalers. Hopefully we'll figure out a way that we can come up with a method that you might qualify for getting those inhalers without having to pay for them. But I wanted to know if there's any other medications that you've been prescribed that you might have had a hard time paying for. Is there anything else?
No, there was just one time last winter, it got really cold and the heating bills kind of got high, and so I just need a little help. My daughter lent me some money though.
Okay. Okay. It's understandable. And then I wanted to see, how do you remember to take your medications when they're due?
I just kind of have a sort of a system that I line them up, and then I kind of move them back when it's the evening med. So I just sort of move them around.
Okay.
I did have a pill
And then-
box, but it just got too full. So
I see. Okay. So I did hear that you're getting a little bit of dizziness and you do have to urinate a lot after you take that the furosemide or Lasix. What other side effects are you having from your medications?
yeah, I don't know. I don't think.
Okay. Okay. And then how do you get your medications?
Oh, my daughter picks them up for me. She comes up like about every month and shops for me and stuff like that. And yeah, she
Okay.
picks up my meds.
What if the doctor prescribes something in between the time that she comes up? Do you have another way to get medications when, maybe she just was here and not due back for another month?
No, I just wait for her.
Okay. Okay. And then I guess the last question I have for you, well, there's actually two more questions, but so how in the last week, if you think back in the last week, how many times would you say you missed the medication for one reason or another?
No, I haven't missed any doses.
Okay, good, good. So my last question just is what pharmacy do you go to, just so that we have our records correct?
I use that one over at the hospital.
Okay. All right. Well, those were all my questions. So what questions do you have for me?
Nothing really. I hope you can get something with that pain. I feel like I'm taking a lot of medicine for that, but I feel like if I could just get that under control, I could get up and move around a little bit and things might be a little bit better.
So I certainly will bring that up to the team. We'll be meeting later today to talk a little bit about what we can do to optimize your medications. And like I said, I will discuss with the team also that you are taking both the pramipexole and the Maripex, just to check in with both the team and then with the prescriber, so whoever prescribed that, just to make sure they really want you on both of those. So,
Yeah.
but we will be getting back with you after we meet and hopefully come up with some ideas that will help not only your pain, but some of those other symptoms that you're having that might be contributing to your falls as well. So it was very nice to meet you, and I hope you have a good rest of the day. Expect to hear back from us within a day or so.
Great. Thank you so
All
much.
right. Don't know if anybody has a depression screen that they did on her.
And so her depression screen, her PHQ-2 was actually a 12, which puts her into kind of the low, moderate kind of symptoms of depression. But I think on top of that, she acknowledges feeling, sad and depressed as well. So it sounds like, despite being on a pretty high dose of the Prozac, it's also not, treating very effectively the primary symptom of her depression.
Okay. What about her family? Did anybody find out any information about family? Is she living by?
Yeah, I think also contributing to that depression is her social isolation. There's a couple of things here. One, her husband died about a year ago, and she has not received any grief support for that. So that's definitely something I'm going to look into. I know that the hospices are providing a virtual bereavement support group, so I'm going to look into that for her. But also, her daughter lives 3 hours away and is also working as an RN in an emergency department. So she's very concerned, obviously, about visiting with her daughter with COVID concerns and such. But is comfortable in the Zoom format, like we did her assessment today. She was also very connected to her church, and she would attend once a month, but was a regular volunteer. So to address that, definitely to increase socialization, she was open to me reaching out to her minister to see if maybe some volunteers could come by the home. She was a little hesitant, a little embarrassed about that at first. Doesn't want to be a burden on anyone, but did say that she would be open to that. So I think that will help considerably if we can address the grief and loss and just really not having connection right now with family and friends.
Okay.
And
Oh, go ahead, Barb. Sorry.
I'm sorry. I agree. I got the same impression from her. you know, when I spoke with her, in addition to the falls, I think really one of her primary concerns was just pain management. And given the number of medications, I guess from an occupational therapy perspective, I'd like to approach it a little different way from a non-pharmacologic perspective. And she has limited range of motion. She appears generally weak, and she reports essentially that she is not really participating in terms of anything socially. She's really disengaging from any real meaningful occupation throughout the course of her day. She seems to be closing in her environment pretty much, right, you know, limited to the chair that she's in. So I would really like to work on some general range of motion, some stretching, some general, or some very light exercises to get her moving, to build up her endurance, just to give her a little more confidence in terms of getting out and doing. I agree that I think we need to harness all of her supports, though. She seems to have disengaged from all of her supports, and her dependence on her daughter is growing, and I don't know how realistic that is, you know, over the long term. So I have some concerns there. I also think that part of her pain, going back to her depression, could be psychogenic in nature, and that there may be some grief there that's exacerbating that sense of pain. And I think that we need to look carefully at that as well.
Yeah, it's always interesting, right, when we're seeing that combination or that interaction between, depression and grief and those pain complaints. I think that's real important. I agree.
I think that from what you said, if we were going to try to treat the depression a little bit differently, choosing a medication like duloxetine may help her with her pain and with her depression both. So that would be something I could provide the team with, a way to cross-wean that, to switch over from Prozac over to duloxetine as an alternative.
Okay.
Well, and she's also hopeful that once the medications are worked out, so the nausea is eliminated, ultimately she would be very open to having a meal delivery service. She was concerned about the cost, so I reassured her that any of the assistance we're talking about bringing into the home, that I'd find out what's covered and what's not covered. But just based on her recent fall and hospitalization, she'd qualify for free or very reduced meal delivery. So she was open to that. But she would like, if she has her appetite back, I think that will help overall as well with not feeling so weak, because she shared she's pretty much eating soup and crackers right now because of the nausea.
Right, right.
And
Okay.
on the short term, I really think that she could use some adaptive equipment, particularly in the bathroom where some of the falls have already occurred. I think that just having place, regardless of, you know, if we're able to build up her strength and endurance, I think that is a good proactive approach in managing things now and in the future.
Okay.
So
Well, go ahead, Sue.
getting back to the pain, right now she is on Norco and she's taking 8 tablets of Norco a day. I question if that might be contributing to her constipation as well. So I think it would be a good idea to try to start to back off that opioid a little bit. So a good starting point would be to separate the hydrocodone from the acetaminophen, and to provide her with some acetaminophen on a scheduled basis, which for most patients will work much better, although we usually have to convince them of that. So acetaminophen, 1 gram Q8, and then probably going with an oxycodone 2.5 milligrams that she could take 1 to 2 QID as needed, but really with trying to get her to use less of the oxycodone. We might think about some of the other non-pharmacological approaches to her pain. I really like what you're talking about with getting someone involved to help with her grief that are probably really contributing to her pain, getting some of the adaptive devices and the other things that may also help with that. But if depending on where her pain is, we might be able to use either a lidocaine patch or diclofenac gel. Those are two other things that may help us to reduce the opioid that she's actually taking. And I do think she's been taking this now for a while, so in order for her not to withdraw, that we'll have to start to slowly back off on that opioid as well, as hopefully her pain becomes better controlled. But we want to make sure she also doesn't withdraw from the opioid.
Okay.
I think those are certainly reasonable approaches. I think it's just needing to keep as we're thinking through her pain, that she does seem to have two sources of physical pain, not only her osteoarthritis to her knees, but also the neuropathy in her feet and lower extremities because of her diabetes. So also just thinking about how we're managing her other chronic illnesses and how those relate to her pain complaints and or her depression as well. So we probably need to think about diabetes and optimizing that treatment, maybe considering going along with those meals once the nausea is under control, really thinking about, do we get diabetic education in there so that she can, hopefully with all the support, really kind of reharness her ability to, navigate her chronic illnesses herself.
Yes, I absolutely agree. So certainly, I wasn't aware of the fact that some of her pain was neuropathic. My interview did not reveal that, and we didn't get into it too much. But with neuropathic pain, getting her sugars under better control, and the drug she's on right now is not the best one. So I think switching her over to metformin will probably help her to some degree with that, without increasing her risk of having hypoglycemia.
Okay. Well, I think we have a pretty good plan. So we can pull our pieces together and meet with her and discuss our plan with her. And thank you everybody for coming to the meeting, and I'll make that appointment with her.